Betty Ferrell. I'm really glad to have the opportunity to participate in this conversation. My background and perspectives on the international work in palliative care come primarily from our ELNEC project, the End of Life Nursing Education Consortium. And ELNEC is an educational project that began 20 years ago as a collaboration between my hospital, the City of Hope, and the American Association of Colleges of Nursing. So through this project, we've been involved with training in palliative care, and we've been very fortunate to also be involved with a great deal of international work. In 2019, the ELNEC project celebrated a great milestone when we reached our 100th country. Palliative care is so important, has always been important, but is very important for all serious illness and for the most competent and compassionate care for people at the end of life. Certainly over the last year and a half, we've all learned through the COVID pandemic how really true those principles are, as globally people have tried to provide the best care to patients and to support families as they face COVID. And when we use the word equity, to me that has a little different meaning in the international context, because so many countries that we've participated in, I would say that everyone falls into the category of the seriously underserved. People are trying to carry out palliative care in nations where on a daily basis they're still struggling for clean water and food, where there's extreme poverty, where there's not access to any health care, not limited, of course, to palliative care. And so, palliative care is just so important as a component of the overall need for equity and just access to health care. So I think now is the time, now's the opportunity. We have a wonderful history over these years of seeing how our colleagues around the world are doing amazing work to promote palliative care for their communities.